As you know, we've started a program where we are assisting persons who require dialysis with some financial assistance. Last year, the government introduced this program where patients would get $600,000 every year for dialysis treatment. We are very pleased that for this year, we have been able to pay out close to $50 million to about 80 something persons who came in to collect their monies. And this is going to continue throughout the year, and I want to encourage all persons who require dialysis treatment to come to the ministry, enroll in the program so that we can give you the assistance. As far as I'm aware, the reaction from most of the patients has been that this has been quite helpful to them because with the amount of money that we are giving them, they can now access dialysis in the various regions. One of the things that we were able to do over the last year too was to partner with a number of organizations in making dialysis available in Region 6, for example. We have dialysis in Region 4. We now have dialysis in Region 3. We have dialysis in Region 2 and dialysis in Regions 10. So this is an expansion of the program. Previously, most of the dialysis was done in Regions 4. So with these additional sites, people who are affected can go to their respective regions and get care and treatment there.
My dad, he fall ill about 1 year, 6 months ago, and he was diagnosed with kidney failure. And with that illness, um, it was a lot of cost on us to afford him the treatment that he needed. But we thank God for this intervention by the government of Guyana to assist all dialysis patients, because I could remember when I was young, my aunt had kidney failure and there was no sort of treatment in this country, not even assistance. And she had passed away at a very young age, 50 something, I think, I can remember. But today, the intervention by the government is something that is good. I've seen it help a lot of dialysis patients, because if I can say this, the money that we're receiving, it helps a lot, because some patient does it 3 times a week, dialysis treatment, some does it 2 and 1. We've seen that they have seen that there is a need, and they've shown that they are here to help those patients. They have take the necessary step, and we want to compliment the government for taking these steps to assist patients, because there are a lot of people in this country that are suffering with kidney failure and they don't even know. It is because of their lifestyle that they're living. So one of the things is we got to start doing is educating people about kidney failure and how to prevent it and what we need to do, the lifestyle changes we need to take, and the step to make our population healthy. That the 600,000 will go towards help, not to help it when it's already happening, but before, to assist. I just want to say thanks to the government again for the intervention. It is a great help, and we're looking forward to more continuous help from the government of Guyana.
Thank you, Peter.
I'm married. I have 2 kids, 8-year and 3-year-old. And I'm diagnosed with kidney failure since 2001. It is not easy. It is hard because when you're dealing with small children, you have to get a patience, and sometimes they get you up and down, they get you a bit tired, you gotta rest, and it is not that easy to handle. My wife mostly does gotta assist me plus the children, so sometimes we find it a bit hard, but we still manage to cope with it. First of all, I must tell the government thanks for their support because it benefit me a lot, and I must give God thanks and praise for life, because if it wasn't for him, I wouldn't have been here. So I give God thanks and praise. And the support from the government, it helps a lot. Very well, it helps a lot, because if it wasn't for that, I don't know what I would have.
How long have you been on dialysis?
About for 5 months now. I was done. They couldn't comment. They said kidney failure. That's what the doctor said. And thank you very much for their little bit of assistance. Still thank you the government for their little bit of assistance.
I've been on dialysis 3+ years now.
Okay, and what is your condition?
End-stage renal failure. Well, the government assistance is a great thing for me. It certainly goes a far way in helping me with my dialysis-related expenses. Some people believe that dialysis expenses is just paying for the dialysis, but then you have to get to and from dialysis. You have nutrition and so on, something that we can hardly afford. So this assistance goes a very far way in assisting us with those related expenses. Well, I doubt that there is anyone that hasn't sought the assistance because I know that dialysis, it's very difficult. I haven't seen a dialysis patient yet that can afford dialysis. Dialysis, even if you're rich, it makes you poor in a very short time. So I would say to all those, if there are anyone out there who haven't sought the assistance, to kindly do so. It will certainly go a far way in assisting you with your dialysis expenses.
I've been on dialysis 7 years now.
Okay, and what's your condition?
Well, end-stage renal failure.
What was that process like for you?
Well, it's not very hard. It's quite a simple process. You go get, I think it could be a bit more organized in the initial stage first, but after that it's quite fluent, I should say. Simple. Well, it's been a great help. 7 years on dialysis, the financial aspect of it is very demanding, and as my colleague said earlier, a lot of people think the dialysis is just going and have the treatment, but it's a lot of other things that related to it, a lot of complications health-wise, people with eyes, bones, and all these things cause extra financial assistance. Apart from that, your diet you have to maintain, transportation. So it's a great help, Yeah, of course, we're very, very, very gracious for the assistance.
On March 9, 2023, the world observed World Kidney Day. The theme for the World Kidney Day's observation was Kidney Health for All, preparing for the unexpected and supporting the vulnerable. This theme was actually chosen because of the COVID pandemic. We realized that during the COVID pandemic, many health services were affected. And coming out of the pandemic, we wanted to, many persons with chronic diseases, especially kidney diseases, were affected because they were unable to access services readily and on a consistent basis. And so in moving forward in the long term, we are looking at how those patients with chronic kidney disease and chronic medical conditions can be protected from these disasters, these pandemics and natural disasters. So the world wanted to look at how we can better prepare for them and treat them and care for them during these periods of disaster. In Guyana, we know the health system was affected, and patients with chronic medical conditions, including kidney disease, were also affected with being unable to access care on a consistent basis. And so we wanted to place some emphasis on these conditions so that in future they can benefit from not having to have these services during these times of disaster. In Guyana, kidney disease actually it is estimated affects about 15% of the population. That is about 112,000 persons, the adult population. In fact, actually about 2 to 3% of the adult mortality is actually related to kidney disease. The most common conditions which is the chronic kidney disease or chronic kidney failure, of which the two most common cause is diabetes and hypertension. There are also other causes of kidney disease, such as polycystic kidney disease, which is a genetic disorder. Infections, chronic kidney infections, can also lead to chronic kidney failure. Certain use of certain medication or drugs, such as steroids, overuse of steroids, or non-steroidal anti-inflammatory drugs, who abuse those drugs can cause kidney failure. But in Ghana, we know that about 15% of those, the two top most common causes, diabetes and hypertension. And we wanted to place emphasis on treating this condition, and so that we could prevent persons from going into chronic kidney failure. Because chronic kidney failure, or what we call end-stage renal failure, it's usually end-stage disease. And the only treatment for it is actually a kidney transplant. Things like dialysis and other medications can only help to prolong the inevitable. So focus should be placed on preventing persons from actually progressing towards end-stage renal failure, so that treatment of diabetes and hypertension, early diagnosis and treatment of hypertension should be priority. Patients who are obese are very much prone to diabetes and hypertension. And we know in Guyana, about 50% of our population are actually obese. And so there's one area that we want should be placing attention to focus on, so that we can reduce the impact of chronic kidney disease on the population. What we are doing actually for patients with chronic disease, kidney disease is, well, we have some services that we provide. We do have, for patients who are already diagnosed with end-stage renal failure, we have dialysis as a part, treatment, that temporary treatment until they can get a kidney transplant or organ transplant, or sometimes until or prolong their life. Dialysis treatment is now being provided both in the private sector and in the health, but predominantly in the private sector with support from the Ministry of Health. Recently, last year, the government have been providing a grant of $600,000 for persons to pay for dialysis services. A person who is put on dialysis actually needs dialysis 3 times per week, and the cost varies from between $8,000 to $12,000 per dialysis session. And this can have a significant impact on person's financial status, and depends upon financial status. And so this grant can help them to tide them through during that period while they're on dialysis. Also, we are actually doing in Guyana organ transplant. Kidney transplant is one of the most common transplants we actually been doing. And we have the capacity to do kidney transplant. Presently, we are only doing kidney transplants from live donors. That's actually a family member or a live donor donate a kidney to the persons who are in need, and then we do the transplant. To date, we have done over 45 kidney transplants in this country. And they have a team which is based at the Georgetown, who's been trained overseas and can do kidney transplant. Last year, the minister piloted the Organ Transplant and Tissue Transplant Act, which set the arena for transplant from donor transplants from what we call disease donors, persons who might be declared brain dead. We can harvest those organs and transplant them onto persons who are waiting on a waiting list. That act has now set the framework for us to expand on organ transplant, especially in the area of kidney, not only kidney transplant also, but other transplant, but mainly kidney transplant will be the focus. Also, for kidney disease, persons the ministry is granting them, because persons who have had a kidney transplant need to be on lifelong immunosuppressive drugs. The ministry provide those persons free of charge all those drugs, and there are also another medication that they need because of their kidney transplant. They need these medication for a lifelong, which is provided free of cost by the ministry. Those are some of the things that we are actually doing for persons with chronic kidney disease. But the emphasis should not, as I mentioned before, is to prevent people from actually progressing to end-stage renal failure, and to place emphasis on the management of the 2 most common causes of kidney disease in this country, diabetes and hypertension. And so we have the new encouraging patients to be diagnosed early, and to be with diabetes, those who are with diabetes to be on consistent treatment, and those who are diagnosed with hypertension to be on consistent treatment and have regular follow-up, so that they do not progress and also to detect whenever they're if they're developing signs of kidney failure, so that we can prolong this complication from these conditions. Persons diagnosed with end-stage renal disease can have a significant impact on their quality of life, and also for the persons who will care for them. Because many of these patients are unable to work or care for themselves, and they'll need the support of their family. And so we would encourage persons who are our relatives or family members, for those who are dealing with patients with chronic renal failure, to be very supportive of them, because they will need assistance and to take them to the hospital, take them to the dialysis treatment, and so on. And this is something that can take a very burden on the family, place a large burden on family members. And so we urge those persons who are caregivers to be supportive of these patients. They will need the support of family members, because it's not on the healthcare system alone, but we also depends upon the support of family members to be part of the healthcare team, because they provide a significant support for those persons. They have special diets. They have to come to clinic at least 3 times a week. They have to be on specific medications, and so this is a coordinated care, what we call a team approach between the healthcare providers and the care providers at home. We would encourage persons, who are at risk from developing diabetes and hypertension. If you know your risk factors, you're at risk. For example, you're overweight, you have a family history of diabetes or hypertension. Get screened early so that you can detect these conditions early and start on treatment, because we know that if these conditions are controlled, you can actually delay the onset of developing end-stage renal failure. Many of the patients who we see with chronic disease, kidney failure, are actually those who are not poorly controlled or who are diagnosed late in the disorder, and they end up in thing. It is, I think, that about 50% of these patients actually develop end-stage renal failure. But we can reduce that numbers and reduce the impact of kidney disease and end-stage renal disorder in this country by actually dealing with these risk factors, and such as diabetes and hypertension, and treating them and prevent and controlling them.
Since he's been diagnosed with this kidney disease and he start doing dialysis, it's a whole new journey, a whole new lifestyle with a lot of challenges, because concerning his diet and things that he used to do he cannot do anymore. And it's not easy being a dialysis patient with going and in the center and have to be in that one position to do dialysis. So it's a lot of challenges. And I want to say a big thank you to the government for this kind of initiative. It's a very great help, and a big thank you to them.
I would like to thank the government, especially Ministry of Health Minister Frank Anthony, for assisting these dialysis patients. It helps them a lot, a great lot, and I would like to say thank you to the government for keeping the good work.
How much of the challenges would this assistance
Well, it helps him a lot because it's 3 times a week he's doing it, and it goes a little way, but we expect to have a little bit more, so that it would go a bit farther, because it's very expensive to do.